So we are live. Soojin, thank you so much for joining us today. And I just want to add, this is a series I've been doing on LinkedIn, Motivation for Mondays on Sundays, so that people are excited about their week ahead. And I've learned it's not just the week ahead, it's life in general. It could be days, weeks, months, years. How do you stay motivated in what you want to do and accomplish new things and get excited about what's around the corner for you? Soojin, you started something that my heart just goes out to you based on where you came from on a personal level through your family. I see the same things with my family and all around me working in healthcare. We are both pharmacists. And today I'm trying something new through this platform. I am streaming also to Facebook because my parents and their friends are running into a lot of the same situations in our healthcare system. Even when you have phenomenal doctors or other healthcare practitioners who care, all around us as pharmacists, you and I both come from being pharmacists. We are pharmacists. We're working in unique spaces as well. We see things that don't flow like they should. There's an old joke here. I am in Las Vegas, so welcome. If anyone's joining us live, let us know where you're from. In Las Vegas, there's a joke here that will say, where do you go for good healthcare? And the joke is the airport, where you get on a plane and get out of the city. Unfortunately, it's not
Oh,
really funny because
oh
healthcare here,
no.
even though we have a city or a county area of over 2 million people, there is phenomenal doctors. We have a very, very broken system, to the fact that my father was doing a follow-up with his cardiologist recently and was supposed to go get a procedure. And he got a letter in the mail that said, your hysterectomy has been approved. Yes, my 80-year-old
Oh,
father. And all we could do is laugh, right? Because clearly somebody entered some code that didn't translate right. And it actually took him a bit of time to get that coding and wording corrected so he could have his heart procedure followed up on. Who is not paying attention? Oh my gosh, we have somebody from Nigeria. And thank you so much.
oh wow.
Yeah, I'm telling you, people around the world see these, and it's really exciting because this is what I've seen. Healthcare is a global problem. It's not just
Hmm.
a US problem, and it's not definitely not just a Las Vegas problem. So, Soojin,
Right.
I am going to let you take the stage. Tell us a bit about yourself and what you're doing, what you have coming up.
Thank you for having me, Danielle. So my name is Soojin. I'm a co-founder of Patients for Patient Safety US. We are a group of patient safety activists who've experienced medical harm, either directly or indirectly in healthcare. We have 10 co-founders who've experienced some level of medical harm. So some of us lost their loved ones, experienced harm themselves. And we work under the umbrella of World Health Organization. So we're a volunteer group. We're very passionate because of our personal stories, but we all have same goals of making sure patients and caregivers are heard and seen and their voices are heard. And we advocate at policy level, which means we work with governmental organizations, nonprofits to make policies to be there when patients need them. And there is a global patient safety action plan that was published by WHO, and it's Global Patient Safety Action Plan 2021 to 2030. And we hope to bring what WHO is trying to bring in the world to the United States, making sure that we are aligned with what rest of the world is trying to do. So yeah, I'm very excited to be here. Also, I work full time as a pharmacist and at a hospital. I'm a board certified geriatric pharmacist. I changed my career from an interactive multimedia designer and wedding videographer to be a pharmacist. I know it's a drastic change of career after I lost my father to medication error, among many things experienced in medical gaps as a foreigner from South Korea um, while in the US. So yeah, so I'm very passionate about the changes I'd like to see in the world and the healthcare. And like you said, patient safety is a global issue, as our healthcare in general are very industrialized. So what I mean by that is once you do your part, as we are practitioners, we don't know what happens to the patient after they walk out of our site or, until they come back, possibly. So the continuity of care, even like the patients themselves, and they have to figure out where to go next, all this navigation issues because of the complexity. It's happening more and more in the world, and as world is more globalized, so you really don't know when your coworker is like living, right? The remote working is so liberalized now that you could be working in a foreign country, and they may have to seek healthcare there. There, I think there's emerging issues that's coming up more and more because of those things that I just mentioned.
Suji, I just want to say I'm just so sorry. Every time I hear this story with your father, and I get chills. And you're not
Thank you.
alone. This is happening to others as well. And you've made those changes. And I didn't know your background. So you made that change, pharmacy school, like any healthcare med school, any of these, it's not for the weak of heart. They are challenging programs. They're heavy sciences. I actually came from a background in hospitality and hotel restaurant
Mm,
management, and and
yeah,
and then went to pharmacy school. I'm a third generation
right.
pharmacist, knew that's what I wanted to do. Life took me in a circle. Fortunately, it was not because of harm done. And we
Mm,
see things like this, though, every day. If you go into any retail pharmacy, you're going to see a box or now a digital file of prescriptions that the pharmacist looked at and said, something's not right here, whether it's an insurance rejection, whether it's a dose or a drug, whether it's just something when everything went electronic and the doctor's offices have to choose from a drop down list that doesn't match. Or my dad's case, like a referral, not to do with pharmacy, but a referral for a procedure that clearly isn't meant for an 80-year-old man, for a young female. And we look at these things, we go, what can we do? And I always say that pharmacists needed we need a new publicity consultant. So many people in pop culture think that pharmacists stand behind the counter and count pills by fives and put them in vials and say, here you go. And that is not what we do. In retail pharmacy, I would say like a lot of times we're flying blind. We don't know that patients, what's happening in their body, what other doctors they're seeing. We often only know what that one prescription is and what health insurance they have, or if they don't have health insurance. And then we do the best we can to get them their medication and to help them understand their disease state in a matter of seconds. It's a
mm,
crazy system, right? And I
right.
know while it is unique in the United States, not necessarily other states, retail pharmacists do work in like different methods and different ways, have different freedoms or lack of freedoms for that matter. In the hospital, I love working hospital pharmacy because you can see what's going on with the patient. You know how their kidneys functioning, their liver's functioning, what other disease states they may or may not have, why they're there. Are they having a procedure? And you talked about continuity of care. I have a specialty working in maternal health with pregnant women. And wow, there's such a lack of continuity. And it seems
Mm,
to be everywhere. So like I said, I've worked with the most phenomenal obstetricians. I'm so grateful for that. But to get to the obstetrician, they're in and out. The patient population I work with these extreme sick women with extreme morning sickness called hyperemesis gravidarum, they're in and out of the emergency room. They're calling
mhm,
their insurances. They might be seeing a teledoctor today, right? They're
mm,
asking their work for time off. They may or may not get approved. They'll lose their jobs and then they lose their health insurance. And then what happens? Or if they weren't on mental health medications, it's a huge population of our percentage of our population is prior to becoming pregnant. A disease state like that will cause mental health problems. And now it's like,
mhm,
who do I see there? Am I seeing a counselor, a psychologist, a psychiatrist? And then who's handling their medication management? And Sujin, that's where you are working so hard to fill this hole, this gap. And I am so grateful for it. And I've seen you're not just working on this committee with the world under that falls under the umbrella of the World Health Organization. You're doing so much else in your local community, all the way worldwide, even clinics for pregnant women in the Philippines. Is that correct?
Yes, so Danielle and I are in the advisory board for Clinics for Life, and our nonprofit organization does try to fill the gap of serving women in countries where healthcare is scarce, and making sure that they have proper care available until the child reaches up to 1 year of age. So in Philippines, there's the first clinic being built, and there are plans to build more clinics worldwide. Yeah, so I thought of you right away
Thank you.
when I was asked to be on board. Yeah, so I am so grateful for what you do for pregnant women. Every time I see someone with that diagnosis, I think of you. Yeah, so
Thank you. And
yeah.
yeah, sorry.
Go ahead. Yeah.
Well, amazing changes are coming out thanks to researchers like the Her Foundation, Dr. Melina Fejo with USC, and others around the world. The UK actually just updated their guidelines, throughout the UK on how they're going to treat women with extreme nausea and vomiting in pregnancy. And I just want to see those changes happen in the US, and they're coming and around the world. And I think we have our guests here from Nigeria. I have a support group where we do have a lot of, we have Nigerians, we have women from around the world and a lot of the African countries. And I'm watching the same suffering happening. And now we're learning why, the science behind it, the genes that are causing it. And hopefully treatments are to come really soon, as my fingers are crossed for that. And,
Hmm.
and that will help fill that lack of continuity. Sujan, what advice would you give to a patient who is feeling like they are lost in the system? Which doctor do they go to? Do they go to their insurance if they're in the United States? Do they talk to their doctor? How do they find a patient advocate such as yourself? Where would you begin?
So my dear friend, Brett Schwartz, he is a survivor of medical error. He strongly believes in private, independent patient advocate being able to fill those gaps. So I always recommend his website. It's gnanow.org. So gnanow.org. And this is pretty much US based patient advocacy website. And you can put in your zip code or what you need. And from there, you can find advocates near you who can, go to doctor's appointments, find the doctor that's right for you. Medication management, I'm on that website. Um, and it can be various different things. It's just so complex that even the very knowledgeable, um, healthcare leaders now come and say, I personally had to go through this, and it was no way possible to navigate. So how can someone without help, or without, who has a lot of burden on the illness itself, can handle complexities? More and more stories like that are coming up these days. So there was a article out there. I thought I saw like a um, former U.S. Surgeon General or something like that, someone like that, had like a $5,000 ER bill to pay after a short visit. So, you know, when these leaders experience it themselves, I think they get a aha moment that
Mhm.
something really needs to be done like right away. So I secretly sometimes hope, like, not to put any pressure or anything like that, but sometimes hope that more people experience this um, somehow and make the changes
Not
that's
not
needed.
medication errors, but being a hole in the
Right.
system. Yeah.
Yeah, yeah, for sure. Because I think it's a human nature. If you don't experience it, it's really hard to see what happens. And that's why I really believe in sharing patient stories, the power of what patient stories can make. Because I think those stories can change people's um, at heart level. And once that change happens at the heart level, then that change can last regardless of funding and all these things that's needed for changes to be sustainable. So I tend to share lots of stories that I know can be impactful um, to really make the changes that's hopefully sustainable.
Is there a story you'd like to share now? I'm putting you on the
Well, I
spot.
mean, yeah, I mean, I had a privilege to share my story in WHO's webinar. And my story was very classic Swiss cheese hole model that, repeatable medication error that was um, at the same hospital. We are the
Mm.
same patient and caregiver who shows up every 2 weeks for the same reason. And ER does what it does, restore, the status and release the patient. And but then there has to be a question when that patient shows up again. You need to dig deeper, right? For the same reason that that patient shows up 2 weeks later for the same reason at the same hospital.
Mhm.
That's questionable, but there's no one to really question that, or no one really curious to know, say why is this happening, except caregiver like me, right?
Yeah.
So that's when we decided to seek care in my country, my home country, South Korea, and he passed away 1 week before our flight.
Mm.
For I mean, and we don't know because there was no autopsy done, but
Mm.
repeated hypoglycemic events can expedite how soon patients can die.
Mm.
So, I mean, we won't know, but I think that might have contributed to what happened at the end. So, it's a, yeah, so I do share my story very openly because I believe there is a lesson to be learned, and we don't want the same thing to happen to any other person out there. And it's a very likely to happen for any patients who are on insulin. So, we really need to dig deeper, and we really need to do a very good job in medication management, especially people who are on insulin. Insulin is a very dangerous product,
Mm.
and it's available over the counter, right? So, right there.
Since this is a motivation this episode,
Yeah.
and it makes your heart very heavy, Soojin. And like you said, you'll never know. An autopsy is not done right, and there's many reasons for that as well. So if you have a patient contacts you through JNA now, and they're on insulin and they're having repeated visits to the emergency room, their ER, just like you said, they're experts in acute care. They're going to get you trained. I mean, trained. They're going to correct the situation why you went to see the emergency room. Somebody from there may decide, are you going to be admitted? You're going to be discharged. That's one of the things I tell the pregnant women who reach out to me going, I'm going back to the ER. I'm going back to the ER. And my insurance won't cover like an infusion clinic or home health, or home health might not know
Mm,
everything and they're not communicating the
gotcha.
information back to my obstetrician. So I'll tell
Right.
them, well, ask, who decides if you get admitted or if you get discharged. When you get
Mm-hmm.
admitted, does that hospital have an antepartum floor, or are you going to
Mm-hmm.
be just in, depending how early, or a lot of hospitals used to be 20 weeks till you get to see an obstetrician in the hospital. And then otherwise, are you being sent home? What's the follow-up steps? Do you have prescriptions that they're going to send home with you so that you're to prevent those repeated admissions to the hospital? And
Right.
then, right, who navigates that insurance? So that's where a patient advocate, and I tell any pregnant woman who reaches out to me, because you already know by the time they found me, they're in really, really bad shape, to the fact
Mm-hmm.
that so many terminate or have in the past. We have laws changing that would prevent that, and they're left malnourished and dehydrated, and that's not okay, right? So if you can
Right.
bring a patient advocate, I absolutely love what you're saying. A paid patient advocate, they're trained in this. There are certifications, not all of them are, but just look at their credentials, their healthcare
Right.
background, who they've worked with, right? Testimonials, and decide from
Mm-hmm.
there. You don't have to have a certification for this. If you don't have a professional paid advocate, bring a friend, bring a family
Right.
member, right?
Mm-hmm.
And if you find yourself alone in the hospital, ask for their case manager. Now, the case
Right.
managers or social workers, right, they do work for the hospital system usually, but they're going to listen, and you're going to make sure that what you're saying is charted in that EHR, that electronic health record. So if you're saying, hey, I asked for this medication and I was denied, or look, I've been back every 2 weeks for the past month, but I'm just stuck here. Can somebody help direct me? Where do I go next?
Mm-hmm.
Make sure that they're charting that, or that
Right.
I would say, like, look at your records. It's really hard, actually, especially during when COVID hit, to get a copy of your medical records. The hospital where my
Mm-hmm.
mom had gone in at that point, I don't know, we had to go through some third party and send an email, and then it never happened, and you weren't allowed in the hospital.
Mm-hmm.
And it's this
Yeah.
constant changing, right? And with HIPAA, we have in the United States, which is meant to protect the patient, often makes it difficult. This blew my mind.
Mm-hmm.
I, as a pharmacist, if I'm working
Yeah.
in a pharmacy, whether it's retail, hospital, or elsewhere, cannot look up my own medical records, like,
Mm-hmm.
unless I'm actually in there as a patient. This has gone overboard. Unfortunately, those are the rules that we're with. So also made me think of, right, if you have someone else that you would like to be part of your care, make sure you get that HIPAA release with every provider. And I'll add, we learned this one the hard way with my parents. Fortunately, they're still alive and well, and hopefully for many more years. They've been married now like 60 years. But when one of them with my dad, about a decade ago, was in the hospital, my mom was not allowed to access his medical records because she didn't
Mm.
have a medical power of attorney. So I'm going to ask
Yeah.
everyone, get all your powers of attorney updated. And even though you have a general power of attorney, that might not cover a release of medical records or talking to those providers to help your loved one who isn't able to speak for themselves or make clear decisions at that time dealing with a disease state. Oh my gosh,
Mm-hmm.
this has been a bit of a kind of a sad episode. So here, like we said, there's so much you can do. So let's pull it in that direction. You have great success stories. I've worked with you. I know you a bit anyways. You pulled me in at an amazing conference. You didn't have to. And you said, come join me, because all of us have some type of trauma in our past that we want to overcome. We're human. The level of trauma is going to vary. Hopefully for most of us, it's not much at all, but we've always been around some mean person or a doctor who didn't listen to us. And we want to be able to take that information, walk into our doctor's office or an emergency room or a specialist, and have a clear dialogue, a clear communication. This is where I came from. This is my disease state. What's next? And here you are. You have patient advocates like yourself working both locally and on a global level. You have something really exciting coming up later this year. Tell us what that is.
Yeah, so our organization, Patients for Patient Safety US, has been doing annual march in Washington, D.C. on World Patient Safety Day, which is September 17th. And this year also, we are going to hold the march. And since last year, we've been doing Hill Day on the following day. So what that means is you will meet with staffs at Congress and share your concern, passions, the bills that they need to pay attention to. So you're educating the politicians and people in Congress to be aware of what's happening and what you're passionate about. So I would love to have anyone who's seeing um, this LinkedIn Live. If you're curious about how to get involved, please reach out to me, and we'll go from there. There are many ways you can participate as a champion, a marcher, or at your local level. We're planning to have different ways to make you feel comfortable getting involved with patient safety. It needs to be a priority in our healthcare in our country. And there is actually a report that Presidential Council has formed, and the President Biden has seen this report, and it just needs to be signed by the president. So we're pushing and pressuring the politicians to really take the action at heart, and make sure our patients and caregivers can seek healthcare in safe way.
Safe and affordable way.
Yeah,
I
safe and
personally like to
affordable.
never go to the
Sure.
doctors unless
Right.
it's bad,
Safe and
'cause
affordable
I
for
just don't know
sure.
what bills are gonna show up later, even for something
Exactly.
preventative that's supposed to be covered 100%. I had a vitamin D
Mhm.
test that took me, like, months to I don't know, in the end, I ended up just negotiating down at the
Yeah.
lab, like, something
Yeah.
silly. If
Yeah,
you have
for
a real
sure.
health condition, it's a real problem, and I wish our politicians had the same insurance options and payment plans as we do.
Mm.
And that's always a big debate, and I don't wanna get into politics here because that's not what this is about. This is about we are all humans, we're all gonna have some health condition at some point in our life. It's called living, better than
Mhm.
dying, and here we
Mhm.
are. What can we do about it? In September, Patient Safety Day. And Soojin, if they don't remember who you are, how to get hold of you 3, 4, 5 months from now, what can they Google to find this?
I think if you Google my name, it comes up. But also www.pfps.us is our website, and there are ways you can get involved by being a champion with us. So you can sign up to be a champion.
Absolutely. We need more champions and less I don't want to say complainers, but I just spent a lot of time with my parents and I love you guys.
Right.
But when we see all these problems, we can sit at home and we can say, this happened, this happened, this happened. Going back to my dad, my 80-year-old father with his referral approved for a hysterectomy, right? We can laugh about that.
Mm,
A lot of this, like your experience, is not laughable. And a lot of us
yeah.
don't have time to sit here and fight the system. This is something everybody can do. Soojin, thank you so much for all the work you are doing in the United States and around the world to improve patient safety. We can only get better, and you are making those changes happen. And I just want to thank you so much for getting out on this Sunday and joining me here on Motivation for Monday, so everybody can start their day going, hey, this happened, or I think I might need this procedure. Let me get my ducks in a row now so everything goes as smoothly as possible. And when they don't, I have an advocate on my side who's going to help me. Soojin, thank you so, so much. If anyone found this helpful, please share and reach out to us.
Thank you so much for having me, Danielle.
You're
It's a
welcome.
pleasure.
Thank you. Have a good day and enjoy your week, everyone. See you next week. Bye.
Bye. All right.